Are you a politician elected to your state legislature or to the U.S. House of Representatives or the U.S. Senate? Do you know fuck all about female anatomy and the female reproductive system? Do you wish you knew more about the female reproductive system before signing on to or voting for bills and legislation that affect women? Hi, I'm the Atlanta Atheist, and I'm a registered nurse. I have a master's degree in nursing, so I know a thing or two about the subject. In this series, we're going to discuss some of the facts and intricacies about the female body and her exquisite but delicate reproductive system. You need to know before signing the next bill that seeks to restrict her reproductive choices. Today we're going to discuss ectopic pregnancies. I've noticed that the vast majority of you have no idea what an ectopic pregnancy is. And that's not your fault, but it is imperative that you understand this. Ectopic pregnancies occur in about 1 to 2% of all pregnancies and are responsible for 9% of all pregnancy-related deaths in the U.S. An ectopic pregnancy happens when a fertilized egg doesn't quite make it to the uterus and instead implants in one of the fallopian tubes. This, my friends, is a medical emergency. You see, the fallopian tubes are just that. Thin tubes through which an egg travels and in which the egg is fertilized. Now, if that fertilized egg fails to make it to the uterus where it belongs, it could implant in the fallopian tube. Remember I said the fallopian tube is a thin tube? Well, a baby cannot grow there. Without intervention, the embryo will grow and rip the fallopian tube right open, which will not only be the end of the developing embryo, it will also kill the mother. Now, a fully developed human woman, who potentially has other children to care for, will be dead, along with the embryo, and very well might have left dad as a single parent. A lot of men, particularly busy politicians, would not be able to handle all that responsibility alone. Now, I've heard a few of you ask, during legislative sessions, why can't they just have a surgery where they remove the implanted embryo from the fallopian tube and reimplant it in the uterus? Well, there are several reasons. First of all, that would be a very invasive procedure with tremendous risk to the woman. There would be a very high risk of infection, accidental laceration of different organs or one of the many blood vessels that are present in the area, leading to internal bleeding, and any of that could lead to the woman's rapid and ultimate demise. Second, it is medically and scientifically impossible to remove a few cells with a tiny lifeline to the mother's body and successfully reimplant it into another organ in the woman's body. Again, that would be extremely invasive and in any case will not work. It is impossible. Period. End of story. In summary, an ectopic pregnancy is not a viable pregnancy. Left untreated, it will kill the mother. No ifs, ands, or buts. If found early enough, a simple one-time dose of methotrexate will safely and non-invasively end the pregnancy with very little risk to the mother. I have personally administered many doses of methotrexate to women experiencing an ectopic pregnancy. Most of these women came in with their partners and wanted to be pregnant. Now they will live and have the chance to try again. Sometimes laparoscopic surgery is required to end the pregnancy and save the life of the mother, but that is far less invasive and dangerous than the erroneous notion of transplanting an embryo, which again has zero chance at success. Thank you for listening, and if you need further information, feel free to contact a highly trained and qualified board-certified OBGYN physician. I'm confident they would be happy to help you understand these important topics before you vote for a measure that could cause more women to unnecessarily die.